Hello, I'm Professor McBride, and today we are reviewing Uterotonics. Uterotonics are medications that increase the contractility of the uterus. So this is going to improve the tone of the muscle. So utero is the uterus and tonic is tone. This is going to help the uterine muscle compress vessels at the placental implantation site. So the main uterotonics that we use are Pitocin, Cytotec, Hemabate, and Methergine. So in order to understand better why we need uterotonics, let's first understand what happens with the placenta. The placenta is attached to the wall of the uterus during pregnancy, or the endometrium. And there is a lot of blood that goes through from the uterus to the placenta and back. And this is how we oxygenate and nourish the growing fetus. So at term, we have about 600 to 700 mLs of blood flow every minute to the placenta. So these vessels that supply the placenta become very large. So the placenta is about the size of a plate. And so that whole area on the inside part of the uterus is got these big vessels to feed it. So when the placenta is attached to the uterine wall, we have maternal vein and maternal arteries that go in and out. And these are large vessels. After the baby is born and the placenta delivers, the muscle of the uterus needs to squeeze and compress these vessels to control bleeding. So let's think about the uterus. If the uterus loses a lot of blood through these vessels, if the muscle's not compressing well, then we can have a significant hemorrhage. So time is of the essence, and the best way to control bleeding is to make the muscle squeeze. So there's three main ways that we do this. One of them is by massaging the fundus of the uterus. And so we massage the top of the uterus, and that encourages the muscle to contract. We also are going to think about the bladder. If the bladder is full, it puts pressure on the uterus that decreases the contractility of the uterus. And then the other thing we think about is our medications, which is our uterotonics. And so these are the uterine stimulants that improve the tone of the muscle, make it squeeze so that we can control bleeding. So we have an acronym we can use to remember these medications, which is Please Come Help Me. Please is the P is for Pitocin. C is for Cytotec. H is for Hemabate. And M is for Methergine. Please come help me. These are our medicines that are going to increase the uterine contractility. So Pitocin is our first one for please. Pitocin is a medication that can be dosed either as an IM injection or can be given IV. If it's given IV, it's typically in a 500 or 1,000 ml bag of fluid. And then if it's given IM, then it's usually 10 units that you drop into a syringe. Contraindications are rare, just typical sensitivity to medication. And side effects for this can be hypotension, nausea and vomiting, and water intoxication because oxytocin has an antidiuretic effect. So it causes moms to hang on to fluid. With this, we will, if we're seeing hypotension or nausea and vomiting and it's the IV, we can slow down the rate to help with those symptoms. It's very well tolerated. The C from Please Come Help Me is Cytotec. The other name for this is misoprostol. This is dosed in tablets, and typical dose for this is 600 to 800 micrograms. So depending on how many micrograms your tablets are, you could be giving mini tablets. This can be administered several different ways. It can be administered rectally, vaginally, orally, sublingually, and buccally. Contraindication for Cytotec is pregnancy. This is because if you look in a med book, this is a pregnancy category X because it causes the uterus to contract. In small doses, it also acts as a prostaglandin. So we can use this medication in small doses to induce labor and in large doses as a uterotonic to make the uterus squeeze. And the side effects for this, the main side effect we see with large doses of Cytotec is a fever. We can also see shivering, headache, and diarrhea. The H is for Hemabate or carboprost. This is dosed as 250 micrograms and is given IM. This can be in a vial or in an ampule. So depending on how it's supplied, you might need a filter needle to draw it up if it's in an ampule. The big contraindication for Hemabate is asthma. If your patient has asthma, this medication should not be administered. And the big side effect for Hemabate is diarrhea. This can be significant. So oftentimes it's dosed with an anti-diarrhea like Imodium or Lamodal at the same time. And then our last uterotonic is Methergine. Methergine is dosed as 0.2 milligrams is what you will see on your vial or your ampule, which is 200 micrograms. It can also be administered orally by tablet. If we are in an emergency situation with a hemorrhage, we typically give it IM. So it can be in an ampule or a vial, and they look like this. Contraindications for Methergine is high blood pressure, hypertension, preeclampsia. If your patient has hypertension, you should not give Methergine. Sometimes if a patient is hemorrhaging, they are currently hypotensive because they're hypovolemic. If your patient has been hypertensive or has a diagnosis of preeclampsia, even if the blood pressure is currently low, this medication should not be given as their uterotonic of choice. This medication is pretty well tolerated. Side effects can be the increase in blood pressure, which is part of the reason for the contraindication, and some nausea and headache. All of these medications can also cause abdominal pain and cramping, and that is because they are making the uterus squeeze, which is exactly what we want them to do. So that is Uterotonics. Please reach out if you have any questions.